Hi, I'm Dr. Gurung. I'm one of the ST training currently working in Northwest Deanery. Northwest Deanery it includes Manchester, Lancashire, Cumbria, and now Northwest has also been a part of mrcpsych. The reason why I'm making this video today is a lot of the trainees who are especially doing CT3 who have not completed the exam, or those trainees who have done the mrpsych exam and who are at the level of like CT3 thinking of taking a break, they tend to ask this question a lot. Okay, what to do next? um, I did my psychiatry trainee from 2014 to 2017 in the same deanery, Northwest Deanery. I had completed my mrpsych paper A during my core training days. At the end of my CT3, there were a lot of things that were going inside my psychiatry trainee, so which I'm not going to, bore people on this video. But the thing that we are going to discuss today is what to do next after CT3. Okay. Um, so there are a couple of options that you can explore after you complete your CT3 if you're trying to take a break. Normally, they in a broad kind of general sense, I would like to divide into three types. Okay, the three types of jobs that you can look for, or some people who are financially better off, who has got a family support, they can decide just to take a time off, go out, explore things. I don't think that is possible because of COVID-19 right now. Okay, now coming to the topic. Okay, what to do after CT3. Okay, once you finish your CT3, people might be thinking what job to do next. This video is focus mainly people who are doing psychiatric training, or those people who have done training outside UK, IMG especially. They might have a better understanding. I'm going to make a different video on that later. Okay, so broadly, let me divide this topic into three parts. The first, and I'm also going to discuss about the advantage as well as disadvantage of choosing these three options. Okay, so let us come to the first one. If you have done your CT3 and if you decide, okay, you like the trust that you have done your CT3, you want to stay over there and complete the rest of your training, in those cases, what you can do is you can discuss with your medical staffing as well as the consultant, especially the lead consultant on the trust, and explore the job options. In terms of job options, there might be two options that the trust can offer you. One is the trust grade post, that is basically an extension of your CT3. The second option, they can offer you as a staff grade, as a middle grade. Okay, in either way, like there might be a difference in the pay slip, but the job will be the trust grade job as a CT3 that you'll be undertaking will be basically an extension of your CT3, but it will be a non-training job. Clear? Okay, so in terms of pay, okay, and the job expectation when you do as a trust grade, okay, will be the same that you do as your CT3. For example, the job that you might be offered might be inpatient as well as community. If you are covering an inpatient, it will be basic the jobs that you do in the inpatient setting. If you're doing a community, it will be a community setting. Okay, so then now let us talk about the advantage of doing a job within the trust and the difference between trust grade and staff grade. Trust grade is basically a junior doctor, and sometimes if you most of the time if you are offered a job as a trust grade, you're also you are also expected to cover the on-call rota. The on-call rota will be the junior on-call rota. Clear? This is in the trust grade. Now coming to a staff grade post will be basically a middle grade SPR rota, and you are expected to cover rota of a middle grade. Okay, the difference between trust grade and a staff grade might be salary. Okay, let us now come in terms of salary. People sometimes might be confused. I am doing a trust grade post, but I'm getting more paid than a staff grade. Let us see why it happens. In the normally, previously in the trust, they used to have old contract as well as the new contract. In terms of old contract, the pay salary used to rise every year 2 to 3,000 pounds, but the new contract is different. So let us discuss about roughly. For example, by the time when you complete your CT3, your basic salary will be, let us say, 45,000 pounds. Okay, that is your basic salary. In the basic salary, your on-call is not added. Okay, now let us see how the on-call works. You might have heard about 20% banding, 50% banding, 10% banding. Percentage and banding basically means, for example, if you're earning like 45,000, if you are 20% on call, that means 20% of 45. Let us say, I'm not very good in maths, but let us say like 10,000, 12,000. Okay, so your total salary will be 45,000 plus 10 or 12,000. So that will be your whole salary in a year. That is before taking a tax. Clear? Normally, people who does CT3 and trust grade post, the on-call will be 50% banding. Let us try to, I'll try to make sense. For example, if you are getting 45,000 pounds, and if it is 50% banding, half of 45 will be 22,000. So your overall salary will be 45 plus 22. It will be roughly around like 62 to 63,000 pounds. So this is the salary of a trust grade at the level of CD3. Okay, when you do, okay, so this is a trust grade. Now let us come to a staff grade, middle grade, which is a non-training post. The salary will be a bit more than, basic salary will be a bit more than a trust grade. Roughly it will start around at 47 to 48,000. It will be only difference of 2 to 3,000 pounds. The drawback of a staff grade is the on-call will be 20% banding, not 50% banding. The reason is the trust grade, if you're covering a junior doctor, during an on-call, you are expected to be in a hospital base. Okay, but if you are covering a middle grade, most of the middle grade they cover on-call, that is non-residential. That means it can be covered while sitting in the home using a laptop, and most of the times you are expected to cover mental health act. To do a mental health act, you need a section 12 doctor. It's a bit complicated, but I will discuss about section 12 in the coming videos. Okay, so now let us focus on the salary of a staff grade, middle grade within the trust. Let us say a staff grade gets 48,000 and the on-call is 20% banding. So that means roughly, let us say 15,000 pounds. So if you calculate it, roughly it might come around like 60,000, which will be less than the trust grade post. So are you clear about the first option? Let me just recap it. Okay, after you finish your CD3, if you are interested to work in the same trust, you can explore an option within the same trust by contacting the medical staffing as well as the lead consultant to see if there is any vacant job within the trust. So there are two jobs that you can look for: trust grade if you're not comfortable to step as a staff grade, or if you feel like you are comfortable at the staff grade and have got section 12, then you can do as a staff grade. Okay, the drawback of doing the non-training job is your career is not going to progress as a training post. But having said that, people who are very motivated, if they do a trust grade for 3 years as well as do the on-call and are able to collect the relevant evidence to show in a portfolio that they have collected the evidence from ST4 to 6, they can be a consultant by doing a CSER route and an AC approved course. Okay, so I'm just trying to make things easier. The advantage of doing within the trust, we are just focused on the first option now. Doing on the first one is, okay, you will have your appraisal within the trust. You don't have to pay extra money. You will get in 6 months, 13 and a half day. In a year, you will get 27 of annual leave. you'll have 5 days of study leave. Okay, you are allowed to attend teaching, which happens once a week. So you will also have some advantage, as well as opportunity, if you are interested in some education activities, to be involved in the trust grade as well as the staff grade. Okay, so but in terms of salary, I've already explained, this is the roughly take home which you might get. We have discussed about the first option. Okay, just to cap up, I've discussed about the advantage of doing the job. Okay, you might be able to do in the same job where you are aware of the work ethos, as well as the work environment. Okay, you might know the colleagues over there. It might be your comfortable area to work. um, Appraisal is provided. Okay, so these are the advantage. Okay, the disadvantage are people who are looking, just to back up their financial burden, or just to make their financial burden stronger before going to ST4. These options might be less favorable. Okay, so this is the first option. So let us keep this first option on the side. Now let us go to the second option. Okay, there are a lot of private hospitals in UK. Okay, most of the popular private hospitals are like Priory, Signet. Okay, and from one of my colleagues, I've heard that there are few of the private hospitals which have already opened. Okay, the good thing about working in the private, I had an opportunity to give an interview in Signet, which is one of the private hospital in Manchester, when I took almost like 3 years gap. Okay, so let us let me try to give you an advantage of working in the private setting. Okay, in the private setting, the thing is the salary will be more. Okay, and it also depends on your negotiation skills, how much you are able to sell your ability, as well as how much you can offer to the trust. In terms of salary, the rough salary they might put straight is £80,000. £80,000 is included with your on-call. The on-call might be once a week. Okay, the job might be busy. Okay, because they pay you and they expect you to work. One of the things which I have heard from people who have worked in the private is very comfortable to work. There might be less politics, as well as you might get a lot of opportunity for you to study and complete your exam. The people and some of the private hospitals, they are struggling to have a doctor, so they might support you well if you decide to do in a non-training job. The Caesars might be very appealing for people who want to do the private kind of job. Okay, so these are some of the advantage of doing in the private. Now the disadvantage is, for example, if they will put you in 6 months of observation. That means that if you make any mistakes during the 6 months, they can fire you on the same day. Okay, so this is one of the disadvantage of working in the private setting. The appraisal will be done by them, which is also good. Okay, but the training opportunity might not be same as working within the NHS trust. And you have to have your peer group. That means that in your appraisal you're expected to get 50 CPT points every year. So the roll callers of psychiatry expect you to form a peer group. That means at least minimum of 3 or 4 people meet 4 times a year, just to make sure that they have got enough CPT points. To get an appraisal, if you're doing a non-training job, you need 50 CPT points. Now let us come to roughly, if you are getting like £80,000, roughly you take home after tax will be something around like 5,100 in a month. Okay, so this is the second option that you have. Clear? So let me recap. The first option that I've discussed is the options of working within the NHS trust non-training job. The second one is the private one. Okay, so now let us come to the third and final options that we have got. when I finished my CT3 in 2017, I worked almost like 1 year within the trust. Okay, then I decided to give some interview in the private hospital, but because of my own preference and my own priority, I went for an interview, but they offered me a job, but I didn't take it. But I prefer to work in an agency. Now, let us discuss how we can work through agency. Basically, the job the agency can offer you can be within the trust, NHS trust, or the private. Okay, and they can also offer in other settings. Basically, an agency, it acts as an like a broker. um, I think that word is it might sound condescending, but basically they act as a middleman to negotiate the pay scale, the pay, how much you might be taking home. So they work as a middle grade. They work as a middle person. Okay, let us take a pause of 5 seconds. I'm giving this opportunity because I've been talking a lot for almost like 15 minutes, and just want to make sure people are following what I'm trying to convey. Okay, so in terms of agency job, okay, agency job is very lucrative. This is good for people who are very flexible, people who are not worried about just settling in one places. They want to explore different avenues, different trusts, different working environment. For me, I'm a person who likes to explore, wants to challenge myself, so this option seemed very appealing to me. So how to get a job from agency? Okay, in order to get a job in agency, you need to contact different agencies. In terms of agency, especially in UK, some of the most popular agencies are, let us say, ID Medical, Medex, Pulse, and there are few, Atona. Those are some of the bigger agencies. There are also few, some agencies like GP Locums and other, which provides jobs. Okay, if you contact them, you might be receiving a lot of emails from them saying, "Oh, okay, doctor, please, there's a job over here. The rate is good. We can offer you this, that." You can have a lot of options like that. So now let me just discuss you how you can get a job from agency. I'll share you my experience so it becomes easier for people to explore agency job in UK. In order to work in agency job, one of the issues might be, for example, like especially international medical graduate, okay, there might be a problem of visa. But if you have got indefinite leave to reside, resident visa, or British citizen, it becomes easier. You won't have any problem with the visa. Number one. Number two is, if you register yourself in an agency, they might expect you to fill up their forms. They do your police check, DBS check. That is, they check whether you have got criminal background or not. They will check that your trainings are up to date or not. Okay, so this process normally takes like 2 to 3 weeks if you decide to work in an agency. But after that, things become easier. In agency, you'll be assigned a person who will look after your document, and if you have got any problems, you can always liaison with that person in an agency to sort out the difficulties in your job place. When you work in an agency, one of the skills that I've learned, I worked in an agency for almost like 2 years, and before I enter my co-psychiatry trainee, after doing foundation doctor trust grade, I took almost like a year off to do an agency job. So from there, that I can correlate my experience. Okay, so the thing that you need to be very confident is your negotiation skills. Normally, if you are, let us say, trust grade or middle grade, after your CT3, the normal rate might be 45 to 50,000 50 pounds per hour. Okay, but it depends on how you are able to negotiate your pay scales. Okay, it totally depends on your skills. So roughly, let us discuss about the pay. Okay, so the jobs that they might offer is 9 to 5, 40 hours. And the good things of working in an agency is you can negotiate that. If you don't want to do an on calls, it could be a good thing if you're preparing for an exam. If you don't want to do an on call, if you want to spend more time with the family, agency is good. Okay, but the problem with the agency is sometimes you might not get a job that you want within your place, and sometimes you have to move far away. So in terms of money, before the government introduced INR 35, that means that there's a cap. The locum agency doctor cannot earn more than the certain amount of money. But in places like Wales and Scotland, that is not the thing. So that can be explored. Agency can pay you by number of options. Number one is PAYE. That means that they pay you a rate, and the agency takes the responsibility of calculating your tax, your payment slip, and everything. But the PAYE might be less compared to an umbrella company or a limited company. Okay, so this is the whole different topics. Hopefully in coming video I'm going to make a whole video on limited company and umbrella company, because I have to go to the court for 2 years and fight for it. In a nutshell, umbrella company and limited company means the agency will give you a lump sum money, and they will give you a responsibility of calculating your own tax. In limited company, okay, you can have an accountant, you can open your limited company. It doesn't take much time to open a limited company, and the accountant does everything for you, calculating your tax year and this and that. But the pay will be more compared to payee, but the headache will be there. So it is up to you which option you want to explore. But PAYE, if you don't want any hassle, PAYE seems to be a nice option. Clear? Okay, so roughly if you are getting like 50 pounds per hour, if you're doing 40 hours, they tend to pay weekly. Okay, if you're getting 50 pounds per hour, 40 hours per week, roughly that might come around like 1050 to 1060. Once you work in agency, you can negotiate your pay scale every 3 months. The contract the agency tends to give is only for 3 months. Okay, and it depends on whether the trust wants to keep you, or if the trust gets any doctors who are willing to work in a cheaper price in the trust grade, the job might not be there for you. So this is the only disadvantage of working in an agency. If you're working in an agency doctor, especially in NHS, from my experience, what they tend to do is they expect, okay, you are paid more money, we should not go for teaching. They expect you to work more. Okay, so this is the only disadvantage. The other disadvantage is you won't get any annual leave or study leave compared to if you work in NHS, and if the NHS are paying you, or the private when they are paying you. Okay, so the thing is you get paid for what you work for. That is the disadvantage of working as an agency. With agency, you have the flexibility of taking leave anytime. Okay, but the thing is you're not paid for your leave. So I've discussed, I've given you something about agency. Okay, so in a nutshell, I have discussed about 3 options after CT3. Number one option is after you finish your CT3, just try to explore an option within the trust where you have worked before. Try to contact your medical staffing as well as the lead consultant, and they can arrange an interview and offer you a job. Number one option. Second option is to explore the private. Okay, in order to get a job in private, if you know some people who have already worked in private, you can discuss, and you can try to find out the lead consultant, and they can arrange an interview for you, and the job might be offered to you. Second option. Okay, the third option, like me, who have done almost like 2 years before now, I'm doing a ST training. is contact an agency. Okay, the agency might offer you a lot of jobs. You can choose a job and you can decide to do a job. Okay, so I've discussed about the three options. This time I'm not using the PowerPoint. Hope the people who might be watching this video might have some idea what to do next after finishing their CT3. All the best.